We are on another episode of SRH Access Facebook Live, and I am here with nurse practitioner Ray Kleposki. How are you?
Good, how are you?
We're excited to have you.
Thank you.
We're actually here at our Plano campus. Why don't you tell us a little about this place?
So we basically treat pediatric fractures, children from birth to 18. We started about a year and a half ago here at North Campus, Plano practice. We're open from Mondays to Fridays, 7:30 to 5:30 roughly. We've taken walk-ins from 7:30 to 9:30 a.m. And basically what that means is any patient who comes in, either seen in an urgent care center, emergency room, doctor, what have you, and may have a fracture or a fracture-like condition, they can just walk into the office. After that, we still have appointments throughout the rest of the day. What we ask, if they have had images, x-rays, disc, that they bring them in with them. And like I said, we'll treat most fractures from ages birth to 18. What we ask is if there's an open fracture, something that looks like it's an emergency, typically they're going to go to an emergency room anyway. Well,
we will definitely get more to the logistics of what we do here at the Plano campus, but today we're talking all about fractures. And later on, we're actually, I'm going to get casted, so you'll get to see a step-by-step preview of that. So right now, let's just get into it. What is a fracture?
So a fracture is basically a broken bone. You know, a lot of people think that when they hear the word fracture that it means that it's something more serious than a broken bone, and a broken bone is not as serious as a fracture. They basically are synonymous terms. There are multiple different kinds of fractures, and any bone in the body can be fractured. We here treat fractures of the extremities, front arms, legs, but you can get fractures of the neck, of the spine, of the skull, pretty much any bone.
Pretty much anywhere.
Yeah, so to put it in shortest terms, a fracture is a broken bone.
That's good to know, very plain and simple. One thing I'm going to add is that we are taking live questions, so please make sure to post your comments below and we will make sure we can ask Ray to get into that. So another question, what kind of injuries cause a fracture in children?
Great question. Well, as we know, children's job is to be active.
Right.
So the most common injuries that we see in children are playground injuries, and that includes monkey bars.
Those are fun.
Really high risk factor with monkey bars. The most common injury that kids get from a monkey bar is called a FOOSH, F-O-O-S-H, which stands for fell on outstretched hand. And basically, children are climbing across the bars, or they go to jump up to the bars, they miss the bar, or they land on their arm. Most common fracture that we actually see will be of the forearm, of the wrist, around here. But a FOOSH can actually sustain a wrist fracture, a forearm fracture, an elbow fracture, shoulder. Trampolines are also high. We have an upswing of trampoline parks, indoor trampoline parks here in North Texas and around the country. We've sports, soccer, football, basketball, baseball, all sports have a high risk of fracture just because kids are more active. We have kids, younger kids, who fall off of couches, fall from beds, fall from bunk beds. So there are just multiple ways that a child can fracture a bone. But the most common that we see is playground equipment. In the younger kids, and in the older kids, it's going to be more sports.
Okay, and so here at the Plano campus, you guys take in all types of fractures, so both sports and non-sports.
Correct. Sports, non-sports. Some people, as I said, can fracture just walking down the street.
Right. You just never know.
You just never know.
What could come in the door.
Yeah, the fractures that, again, we try not to treat here are skull fractures, neck fractures, spine fractures,
and good to know.
Open fractures.
So I think another big question for parents is, for the care of a child who's going through still skeletally immature, still growing bones, and then the care of an adult when a fracture happens. So what is the importance of going to a pediatric specialist for a fracture?
So the reason that we feel strongly about going to a pediatric specialist is because all of the physicians we work with, as well as the nurse practitioners who are my counterparts, are all fellowship trained in pediatric orthopedics. And we have a specialty fellowship training with Scottish Rite and Children's Medical Center, and all of our physicians are pediatric fellowship trained. Why that's important is children, we say this all the time in many of the talks and things that we do, children are not small adults. Okay, so they have open growth plates, they have different types of fracture patterns, they have much more remodelable bone. And what that means with remodeling is their bone has the propensity to remodel and straighten out. So for instance, if we looked up here, you have a forearm fracture that you see at the second level here. If you saw that same fracture in an adult, most likely they would need surgery. For younger kids, we can actually place a cast or do a small reduction, which is placing the bone back in place and allow them to heal over time. Okay. I think it's really important to have somebody who understands the development of bone, the development of the growth plates, and also what are the acceptable levels of each bone at each age. For instance, you have a 2-year-old with a significantly displaced or angulated bone is a lot different than a 12 or 13-year-old or 16 or 17-year-old, which is more like adult bone. The treatment varies per age.
Okay, good to know. I think next kind of coming up is parents needing to know when is it that they should bring their child to see a specialist. I mean, you know, they might have an injury, and what signs should they be looking for?
Okay, so it's a great question. When we think about when a child falls, let's just say, for instance, it's a FOOSH or something like that. Emergently, they want to take somebody to an emergency room or a high-end urgent care if they visualize a bone, meaning if you see a bone sticking out of the skin, we want them to get to an emergency room pretty quickly. If they have increasing swelling, if they look like they have deformity, which basically means that the arm or leg looks like it didn't look on the other side. And it's very simple. If you've only injured one extremity, have them compare it to the other side. And if one doesn't look like the other, you definitely want to seek treatment. Now the question is, do they need to go to an emergency room that night, or can they come to fracture clinic the next morning? And I think that really depends on multiple things. The comfort of the family with what they see. If it's just a little bump and bruise, but the child's still in pain the next morning, then I think it's an appropriate fracture clinic referral. If there's significant deformity or open skin or pain that they cannot get under control, then it may be a better going to an emergency room that night or an urgent care, and we can see them the next morning.
Okay. You were speaking before about, we were talking about the treatment of a child versus a treatment of an adult. So when it comes to the treatment of a child, what is the difference between needing to get casted and maybe if surgery is the extreme option?
Sure. And sort of going back to what I talked about before is the different type of fracture patterns per age.
Right.
Now, surgical type fractures are fractures that maybe we tried to reduce or get back in place and couldn't, or they're just fractures that are inherently unstable, meaning that despite us trying to place the bone back in place, despite putting an appropriate cast on, we know historically that those fractures physiologically are not going to stay in place. They're going to want to move. Other fractures that need surgery, or as we discussed before, fractures that have broken the skin, also fractures that break and enter the joint.
Okay.
Now, not all of those, and it really depends upon the age of the child, the joint that we're talking about, how much entrance into the joint there is, how much displacement, angulation, or where the fracture enters the joint.
So parents just really, it's very variable. Could be
it's completely variable, and what is true for, let's say, the wrist may not be true for a finger, may not be true for an ankle, may not be true for a femur. So we have to take into account the child's age, the fracture pattern, the time between when they broke or injured and when they see us, how much healing is already there. So it's not one size fits all for any single bone or any single child.
Right.
And any single age.
Right.
Right. So as we go along the spectrum of age, for instance, if you have a baby just born, and let's say they have a little break in their clavicle bone from birth, they typically heal quite well in 1 to 2 weeks.
Right.
You have a 18-year-old boy who has an ankle fracture that doesn't need surgery. He may be casted for 6 to 8 weeks. So you see the variability in age. And the younger you are, the quicker you heal, the more remodeling you have.
Okay, good to know. So I think we're going to invite a guest over. We have our orthopedic tech, Raymond, who's actually going to put a cast on me. We're so excited to have you here and show your expertise in this area. So, let's just get started.
Okay, so we're going to be doing a short arm cast.
Okay. Is my position okay?
Yeah.
Okay.
And if you see here, she does not have a broken bone. Okay, so we don't see any deformity here. And as you see, when we place a cast, the first thing that goes on is stockinette, and that's to protect the skin and to keep the cast comfortable. Very much like a sock. These come in multiple colors, white or black, so it's all patient preference. Then the area is wrapped in cotton. And again, the cotton is to pad up the cast and allow protection of the skin.
So depending on the fracture, you know, you're positioning the hand or in a certain position, correct?
Yes. We're positioning the hand in a certain position, and depending on the fracture, it would depend on what type of cast we use.
Right.
So for instance, looking at this cast here, this is a short arm cast, and it basically would incorporate any fracture of the wrist or the lower forearm. If there was anything at the upper forearm, elbow, you're still going to get this cast, but it's going to be extended above the elbow.
Okay.
Very similar for a lower extremity cast, such as a leg. Depending on where the fracture is located, we like to immobilize a joint above and below the injury.
Okay.
Now, for a wrist, most radius fractures or ulnar fractures, which happen at the wrist, can be treated in a cast like this.
Okay. So what's the typical time frame of having a cast?
Great question. So again, that depends on a child's age, but I would say typically for most children, for fractures throughout the body, the typical treatment is 4 to 5 weeks.
Okay.
Older children may be a bit longer, and there are certain fracture patterns that need to be immobilized for up to 12 weeks, but those are minimal in the pediatric population.
Do you have any suggestion on, you know, these kids are active,
Yes.
like we've talked about. So when they're having these casts on for as long as they are, you know, tips on keeping it clean.
Yes.
And making sure that there's nothing else going on in there infection-wise.
Right.
Or...
So we give the families a number to call at any point in time. The risk for infection is very low without open skin.
Okay.
But if there's any fevers, night sweats, chills, any symptoms that seem out of the ordinary, because as fractures are typically non-infectious conditions, then we ask the family to come back in. We don't have them make an appointment, we just have them show up.
Okay.
As far as caring for the cast, what we usually tell families, and I have a little spiel that I tell them, is nothing smaller than your arm goes into your cast. No pens, pencils, erasers, rollers, chicken bones, chopsticks, Cheerios, money. And you would ask, well, why would I put anything in my cast? Well,
right.
Remember our population. They're
curious.
exploratory. They're
Yeah.
curious. The other reason that people put things in their cast is because it itches.
Right.
Right. So we tell families that it's dangerous to slide anything in your cast because that object can get stuck between the cast and the skin, and it can cause skin breakdown, it can cause ulcers, it can cause infection. So if their cast itches, some things that we can tell them is that they can knock on the cast. That helps with the itching.
Right.
Sometimes the families can give some Benadryl or a hair dryer on cool, blow up or down the cast. There are ways to keep the cast clean, but again, we're dealing with children, so it's exploratory. The cast will get dirty over time. It's like wearing a gym sock for 4 weeks, right? It's just going to get a little bit dirty. As far as showering and bathing, there are commercially available things to help cover the cast.
Okay.
We just recommend that they have to keep it dry. There are waterproof options for casts sometimes, but they're really limited on the patient population that can get those. They're limited to this actual cast here. Now, what you see Ray doing is he formed the cast, he placed the cotton into the stockinette, which is the underlayer, the cotton, and then the fiberglass part of the cast. And then that takes about 5 minutes to cure or to harden up.
Okay.
And you also saw that as he was placing the cast, he was molding the cast around the forearm. The idea behind it is you want to mimic the normal position of the forearm, so you want to make it flat along here so the cast doesn't slide and it sort of forms to the forearm. Now, in this poster behind us, you see some fractures that occurred, and if you look along the poster, you can see that sometimes with these casts, if there's a little bit of bend in the bone or a deformity, will actually form the cast against the deformity. It's called molding.
Okay.
And that helps us to keep the bone straight to allow the body to do its natural progression of healing the bone. So that's why many casts, sometimes if you see a child, you see a cast, you're like, that cast looks really bent. And the reason that we sometimes bend it is to get a good mold in the cast and hold the bone straight during the healing process.
Right. And we know that accidents happen.
Yes.
This is why we're here in the Plano facility to take care of those.
Right.
So I think this kind of wraps up our Facebook Live. And thank you so much, Raymond. Did a fabulous job on my first
This
cast
casts
ever.
are always awesome.
Yeah,
She
super
does have to
comfy.
keep it on for the next 4 to 6 weeks, though, because
Yes.
she is an adult.
Right. That's
Yes.
true. That's true. So thanks for joining us.
Thank you.
And tune in next week for another SRH Access Live. Thank you.